doing cervical rotation, active range of motion. So I'm going to start by lining up my goniometer, and to do so I'm going to palpate for that anterior acromion, and I'm going to line up my stationary arm there. And then I'm going to line up my fulcrum with the center of her cranium, and my moving arm is going to bisect her head, lining up with the tip of her nose. I'm going to start at 0, so a normal measurement's going to read 0 to 60 degrees. So I'm going to have my patient look over to the right, and I'm aligning my moving arm, and my measurement reads 68 degrees. And we're going to do this bilaterally. And my moving arm is aligned with the tip of the nose again. Go ahead and look to the left. Tip of the nose. So she has 72 degrees on the left. And again, normal cervical rotation would be 0 to 60 degrees. Some compensatory movements she could be doing is lifting up her shoulders or bringing her chin down. I know. Alright, so today we are going to be testing shoulder abduction manual muscle test, and we're going to be testing the middle delt, which nerve is the axillary nerve C5, C6, and the supraspinatus, which nerve is the suprascapular nerve. Alright, so to start, I'm going to have my patient try to do active range of motion just so I can see if she can get through that full range of motion, which should be about 180 degrees. Good. So now, table. So I'm going to place one hand on her superior shoulder, and then I'm going to extend her arm into abduction, 90 degrees, and my other hand is going to go on her proximal elbow. And what I'm going to do is I'm going to apply mid-mod max pressure while cueing my patient to hold, hold, hold throughout that pressure. So here I go. I'm going to hold, hold, hold. Okay. And so I would grade that on a scale from 3 to 5 because she was able to go through active range of motion. And if she was able to go through mid-mod max, it would be 5, and then we would grade down to 3 if she wasn't able to go through that mid-mod max force. If she was unable to go through active range of motion at the start of the evaluation, I would put her in a gravity-reduced position, and that would be supine. And so what I'm going to do is I'm going to be on the same side that I'm testing, and I'm placing a towel down just to avoid friction here. And what I'm going to do is place this hand again on the superior aspect of the shoulder, really making sure not to compress that deltoid because that's the muscle that we're going to be testing for contraction. And I'm going to have my patient's thumb up. And what I'm going to do is I'm just going to be guiding her, telling her to try to go through that active range of motion, feeling for that contraction of that deltoid muscle right there. If I feel contraction, it's going to be a grade of a 2. If there's just a slight contraction, we're going to say it's a grade 1. No contraction at all of that muscle is going to be a grade 0. And I put, we're starting at a 2 because she was unable to do that active range of motion in anti-gravity state. Today we are going to be doing a scapular abduction depression manual muscle test. And so how I'm going to have my patient start is in this prone laying position with her, we're going to be testing this left side, so I'm going to have her head turn in the contralateral rotation, which means opposite way. And the other hand is going to be placed just to her side. So the side of the scapula that we're going to be testing, I'm going to have her bring her arm out in front of her into that 130 degree position and just slight supinate in. So what I'm going to be doing is I'm going to be placing one hand on the thorax here and another hand on the scapula that I'm testing. So I'm putting my hand here on her lower trap so I can feel that contraction as that's the muscle that we're testing. And this is your accessory nerve, cranial nerve 11, and it's the ventral rami C2, C4. And so what I'm testing is I'm going to have Vanessa just try to lift that arm up off the table, and that is her end field right there, and I can feel contraction right here. So we're going to start at a 3 because she was able to lift that off the table. And so I'm going to have Vanessa lift her arm off the table, and so I'm just going to show her how I'm going to try to put her into that abducted position and upward rotation, and she's going to be resisting that force because we want to test her adduction and downward rotation. So Vanessa, I'm just going to apply mid-mod max pressure here. I'm going to cue you to keep holding, just try to resist that pressure. So start by lifting up off the table, applying pressure, go ahead and hold, 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 and relax. and because she was able to keep that end field as I was applying that mid-max pressure, she was a grade 5. Say she was unable to withstand that force, we would just be testing contractility of that lower trap. So I would have her just try to lift up. If I feel contractility of that lower trap, I would grade that at a level 2. And if she just had light contractility of that lower trap, it'd be 1. And if she was unable to lift that arm up off the table at all, and there was no contractility of that lower trap, it would be a grade 0.